My name is Neethu and I am from OSCE Success Hub Adelaide. In our last video, I was explaining regarding the NMBA Standards and its significance with OSCE for Australian nursing registration. I have enlisted the NMBA Standards in our last video, and today I will be discussing about the first NMBA standard, that is Think Critically and Analyze Nursing Practices. I will be explaining and try to relate these standards with the procedures like medicine administration and wound management. So let's go to the video. So the key components of first standard, Think Critically and Analyze Nursing Practice, are critical thinking, evidence-based practice, clinical decision making, recognizing your limits, and reflective nursing practice. These are the key components of this first standard. Critical thinking means that nurse uses critical and analytical thinking to provide informed decisions about patient care. She will assess information, look for evidence, and think various perspectives related to particular scenario. I will be giving an example once we discuss all the key components. So we will go to the next key component. Next key component is evidence-based nursing practice. In evidence-based nursing practice, the nurse must use the recent research studies and the clinical guidelines to improve their patient care. The next key component is clinical decision making. Clinical decision making is a systematic approach by assessing, diagnosing, planning, implementing, and evaluating the care. Next key component is recognizing the limit. The nurse should know the professional and personal limits she has while practicing nursing. So whenever needed, she should seek the guidance and the expert opinion while giving care to the patient. The next component is reflective nursing practice. Reflective nursing practice means the nurse look back into the actions which she has done and finds ways to improve her nursing practice. Like if she has performed one procedure and she found out some mistakes, and she evaluates her mistakes and find out the ways to resolve and improve her skills in relation to that particular nursing procedure. So she utilizes all the available resources to improve her practices, like relearning the skill, then collecting more information and recent practice guidelines about that particular skill, then seeking advice from her colleagues or seniors. So in a way, the nurse is improving her care by implementing all these actions. So these sorts of self-improvement methods are known as nursing reflections. Let's see the example of medicine administration. A nurse is going to administer tablet digoxin 0.25 milligram to a patient who is diagnosed with a heart failure. While she is going to the patient, she notices that the patient is reporting to her that the patient is feeling a little bit nauseous, and the nurse identifies that patient is a little bit confused. Okay, so let's see what are the critical thinking measures and how she is going to apply all these key components which we have discussed in relation with the standard one. Next is evaluating the evidence. So to find out the evidence for this digoxin toxicity, the nurse first should check the dose of the digoxin medicine which is prescribed by the doctor. So first she should check whether the correct dose is prescribed for this particular patient. Then the next reason for this digoxin toxicity can be the renal implications. Like if there is renal complications for the patient, there is a chance for digoxin accumulation in body and causing its toxicity. So she should collect evidence related to that also. Next is considering perspectives and decision making. Now, the nurse identified that the patient has some symptoms related to digoxin toxicity. So rather than blindly administering the medication, she should withhold this medication and escalate this information to the doctors using the technique called ISBAR, method of communication. This we will discuss in our coming videos. So these sorts of actions are coming under this critical component. Next is acting on evidence. So the nurse already informed the doctor about this patient symptoms, and the doctor might have adjusted the dose of digoxin or withhold the medicine. So she is obliged to follow that instructions. Okay. And along with following these informations, she should educate her patient regarding the symptoms of digoxin toxicity, so that the patient himself can identify, okay, I am going into a digoxin toxicity, so I should inform these symptoms to the nurses or the treating doctor. The last component is reflecting on nursing practice. So in this particular scenario, the nurse, when she reflects, the nurse identify that the critical thinking ability of this particular nurse has helped to prevent the patient going into a complication of digoxin toxicity. At the same time, the inability of this nurse to educate his or her patient regarding the digoxin toxicity symptoms could have made the patient to go into digoxin toxicity. So while this particular nurse gets another patient with who is on digoxin, definitely she is going to teach this patient regarding the symptoms of digoxin toxicity. So that is the importance of doing nursing reflections. Another scenario, in the case of a unhealing wound, while assessing information, the nurse will assess the wound status, the color, smell, any secretions from the wound, and the nutritional status of the patient. Like if the patient has any diabetes, the wound healing will be delayed. If the patient has anemia, the wound healing will be delayed. So that sorts of information she will be assessing, and any antibiotic therapies that the patient has taken before, so that she get to know that the patient has been on these antibiotics and still the wound healing is not controlled, so she might need a higher antibiotic. So in relation to the wound management, the assessing information, these are the examples. While evaluating the evidence, the nurse should assess for whether the patient is following the instructions for wound management, and whether her colleagues and herself is using the correct wound dressing methods, and also the correct hand hygiene techniques, and whether they are using the correct wound dressing for this particular patient. Considering perspectives and decision making, in this, when the nurse thinks that the wound is not healing properly, she should be able to think about the possibilities of worsening conditions like cellulitis or going into a sepsis for this patient. So if she identifies such scenarios in this case, she should be able to escalate this condition, this information to the doctors who is treating this particular patient. And also, she should be considering helping the patient to in a better management of her nutritious status, that is controlling her blood sugar levels, and taking protein-rich food items and nutritious food with vitamins, so that the wound healing can be proper. And acting on evidence in this scenario is the nurse sends a wound swab and identifies that particular antibiotics is effective with this wound. Then she starts this particular antibiotics with the instruction of the doctor. So that is an example for acting on evidence. And also the patient encourages the patient to follow the wound management instructions and follow the dietary management instructions to have a better blood sugar control. So these are the examples for acting on evidences. So as a nursing reflection in this situation, what a nurse can do is, a nurse can formulate different ways to understand a patient. What are the wound management techniques that particular patient can follow, so that the wound is not wound condition is not getting worsened. And also she can refer for the current practices in wound management, like new kind of dressings or any other new policies that have already made, so she can use that. So these are the nursing reflective strategies she can use for wound management. So I think the overview of this particular NMBA standard was useful to you. And if you find our videos useful, please follow our YouTube and Facebook page, and wait for our more videos. Thank you so much for watching us. And it's me, Neethu, signing off from OSCE Success Hub Adelaide.